The following segment is sponsored by Citron Cardiology. When it comes to heart health, it is so important to stay informed. So thankfully we have Dr. Ben Citron with Citron Cardiology right in the Providence Medical Park to talk about congestive heart failure. So last time we talked about what congestive heart failure is. So how do you diagnose it?
Well, the way we diagnose heart failure, and basically just think of heart failure as being the pump, which is the heart, not doing its job. And sometimes it doesn't do its job because it doesn't squeeze well and doesn't allow as much blood to flow through the body as it should. And sometimes it doesn't allow the blood into the chamber. It's gotten too stiff and inflexible, and so the blood backs up into the lungs. The test we use the most to measure this is called an echocardiogram. That's where we use ultrasound probe on the heart, and we actually measure how the walls of the chambers are moving, whether they're thickened or not, and whether or not there's any problems with the valves and other parts of the heart.
And you've mentioned ejection fraction before. What is that?
The ejection fraction is the amount of blood that gets squeezed out of the heart each time it beats. That number is usually about 60%. Most of us think every little bit of blood that enters into the heart chamber gets squeezed out, but actually it's about 60%.
Which sounds extremely serious, but why does it matter?
It matters because that number correlates pretty well with how well the individual will do. If the number is 60% or so, the individual does pretty well. As that number goes down, then the prognosis gets worse and worse.
So how do you measure that?
Well, we measure that. We can do an ultrasound of the heart, an echocardiogram. Sometimes we can use stress tests, CT scans, MRIs, all sorts of other modalities can be used to measure the ejection fraction.
And say you are diagnosed with congestive heart failure, how do you treat it?
The first thing we like to give people is what we call diuretics, fluid pills to get the extra fluid off the body, because that's why people feel bad, because the fluid backs up in their lungs. And then we use all sorts of different medications to lower the blood pressure and also help the heart work better as a pump.
Thank you so much for your insight. And if you have any questions about congestive heart failure or just heart questions in general, come and make an appointment today with Dr. Citron.